to my friends, colleagues, coworkers, and everybody who's physically present, and to all of those out there in Cyberland paying attention and tuning in. Thank you all for being here. My name is Gideon Orbach. I've been practicing chiropractic for closing in on 23 years now and closing in on 17 here with this group. I started off with Dr. Weiner on the south side. We were the pain release clinic then, the pain release center, and we moved to this building at 2419 Baldwick Road in Green Tree, conveniently located right off of Highway 376. So we're very accessible throughout Western Pennsylvania. In 2008, we remained the Weiner Wellness Center for up until Dr. Weiner's passing in 2017. We're now known as the World of Wellness. It's the same group, but expanded with new people, new services, new supplements, new ideas. But we've held on to all the old good stuff that we once had. So I've been here for a while, like I said, closing in on 17 years, and this is at the point in the conversation in the workshop, and I like to highlight that this is a conversation. So if you have any questions, comments, even moral outrages, and want to make yourself heard or known, or want to try and draw me off point, feel free. Let's chat. And if you're in Cyberland, I have IT Savant Phil over here to my left, who is monitoring the keyboards and the wheels of steel and the monitors and everything. So if you want to participate, you're welcome to. But anyhow, this is the point in the conversation where I usually make a joke about knowing where all the bodies are buried, and that gets everybody's attention. And then somebody astutely pointed out that I've been here so long that I probably put a few there. So I'm done with that joke. Well, anyhow, I can talk all day about chiropractic and natural health, and we're gonna make that a big point of today's emphasis. And I talk about other things too, though. I mean, now is not the time or place, but I do basketball, martial arts, delicious island food, foreign currency trading, and scuba diving. So I'm really not that one dimensional and that bad at the barbecues. But anyhow, what I do is hands-on chiropractic techniques. I work with muscles and I work with joints throughout the full human anatomy, the full skeleton, not just a practice confined to spinal mechanics, as many of my colleagues do. This particular center, from the very beginning, we did spine and extremities. We do muscle and joints, and well, he's not new anymore, but Dr. Ross has joined our team, and he's also a full skeleton chiropractor. And so the gist of all of my maneuvers and all of my techniques and what I'm trying to accomplish is always how do we restore better brain body communication. And there are a lot of side benefits and a lot of things that I expect my patients to get out of that as we go along through treatment. And that's what this conversation is all about. So, what I really want to do is I want to ask and hopefully answer two questions. The first of which is, what is health? We have a state of the art nutrition store here. Our nutrition store is as big or bigger than any of the GNCs that I've been in to visit. We have premier brands. We have top flight, highest quality, highest nutrient densely packed products. And we have people who come who shop for nutritional supplements. They stop by to pick our brains for advice. They want to tell their narrative and see what we make of it. They come for chiropractic appointments. Sometimes they just come to hang out and be around us, and we like having them around us, or around them, or them around us most of the time. And ultimately, people come here because they want to be healthier, but we got to have a good starting point. What does it mean to be healthy? What is possessing the quality of good health? What is that? What does that entail? So, as I said, this is interactive, and I have a reticent crowd today. Just usually, people will weigh in on that one and offer their opinions, and I've had some pretty good opinions in the past. And I have a hand raised. That hand belongs to Joe Messina, who's a very, very prominent figure around here. Please, sir. All right. Health is the absence of disease. That certainly works. I mean, we are all trying to avoid disease. And if we don't have disease, we presumably are healthy. I like that answer. I might add to you what you said and say we have disease in the form of illness, but we also have dis-ease that we can't move so easily and we're stuck. Our joints and muscles are stuck. Now, as a hands-on chiropractor, those stuck joints and muscles are pretty big in my world. Anything from Cyberland, IT Savant Phil? All right. Well, then I'll just share my definition of what it means to be healthy. And to be healthy to me means that you have the ability to recognize, interact with, adapt to, and even overcome your environment, both internally and externally. So, the internal environment, what's that? Well, let's start with digestion. In fact, all we need to do is talk about digestion. If somebody puts food or food like substances or chemistry, nutritional supplements, drink, what have you, into their bodies, how are they going to absorb all of those nutrients? And how are they going to take those nutrients and pull them out of their digestive tract and eliminate what they don't need and supply their working cells and their muscles and their nervous system and their heart and their lung with the nutrition and the fuel and the activation that they need? So that's your internal environment in a nutshell. Your internal environment deals with how does your brain communicate with the rest of your body? How does your liver process toxins and expel them? How do your kidneys do likewise? Are you able to push impurities out through the pores of your body? If you have to regulate your body temperature, will you sweat to bring your temperature down? This is all internal chemistry. This is your internal environment. If I mean, we just had the Pittsburgh Marathon recently. My esteemed colleague Dr. Ross ran the half marathon. We all like to tease him a little bit about that and hear the Chariots of Fire music playing in the background. But kudos to him. It's a major, major accomplishment. Big time. Madeline also did the half marathon. I don't I'm remiss. I should have others. I'll applaud for you. And okay, we're gonna let the record show that Madeline beat Dr. Ross. So the problem is we didn't tease Madeline enough prior to the race. So we're gonna make up for it now. But but anyhow, so imagine running 13 miles and change and not sweating. Oh my God. Think about what your internal temperature must be doing. You're like a furnace in there. Ready to you do implode, do you explode? So your internal environment needs to regulate itself to what's going on in the world and adapt to it and overcome. And we're going to start using our sweating mechanisms in order to regulate our body temperature to something a little bit more appropriate than inferno. So, in a nutshell, internal environment. External environment. Well, for me, that's all of you guys. I want to take a time out very briefly to express my gratitude to all of you for not throwing rotten vegetables. I'm quick. I'm a lot quicker than I look. I'll duck most of them. I'll catch a few, but some are going to hit me. My external environment, I feel really, really safe. I ain't afraid of any of you. I do not have stage fright. Born without that gene. I can stand here and talk. It gets annoying for people at times. I don't feel as though any of you are going to chuck rotten vegetables at me. I don't feel as if any of you are going to attack me. Because of this, I'm adapting to my external environment and I'm regulating myself appropriately and I'm not going into defensive posture, defensive duck and cover. Internal environment, external environment. If you want to call yourself a healthy person, you really, really do have to have control over both. So far, so good? Questions, comments, moral outrages? Yes, please.
I feel it's bad for your joints to run on cement because if you take a bottle and drop it on this pavement out here, it's going to break. You take that same another bottle and drop it on the grass, it won't break. if you're doing a lot of running, it's like, really a lot of pressure on that cartilage in your knee. I think eventually your cartilage is going to.
I'm going to paraphrase, okay? I'm going to paraphrase. The question, comment, moral outrage from the crowd is concern for the articular health. That means well-being of your joints when you're running and pounding on concrete. Is that basically it?
Right.
Okay. So it's an excellent point. It's an excellent point. We got to find we are not designed to pound our bodies into concrete like this over and over again. So we take ways and steps to mitigate that pounding. One of those steps is going to be to wear comfortable shoes, comfortable socks that are going to behave as shock absorbers. Doesn't solve the problem, certainly helps. Another way that we're going to mitigate this is we don't run these long distances or even sprints every single day on the concrete. We got to give our bodies time to regroup and recover. You see, good runners will have treadmill days. They'll have rest days. They'll have pool days. Uh, they'll have more rest days, and it's not constant pounding. It's constant pounding over the duration that they're going for the run. The third thing we say is there are other ways that they have to take care of their bodies to do restorative measures. And you really open the door for me to sneak right in and talk about the critical importance of nutritional food and supplementation in order to protect joints. At the top of the list, we're going to say the hyaluronic acid in the nutritional frontiers. Hyaluronic acid includes glucosamine. That's why it's called HA plus. It's more than just the HA. There's additional stuff in it. We myself and Dr. Ross. My next point that I want to get to, the next question that I'm going to ask and answer. You really helped me lead right into it. And I would like to have the authority to speak on behalf of the entire chiropractic profession. I've been lobbying for this for a very long time, and I'm not even close. So I can only speak for myself. And I'm going to take great liberty and speak for Dr. Ross. And I'm going to take even greater liberty and speak for the people who trained me and some of the people who I helped train at this point. And that is, we see a lot of people who running is their sport or running is a key component to their sport. And we see a lot of running injuries. And when we treat people in the early stages, when it's just like, this doesn't feel right, we're able to do them a world of good. And when people have a full blown, I've been running on this knee for 40 years and I've done nothing to treat it, we're at an extreme disadvantage. So your point is very, very well taken. Now, the other thing I want to say is you can't tell a runner not to run. I mean, I don't know where the line is between what's a physical addiction, what's a psychological addiction. But when you talk to an avid runner, the peace of mind that they get in their mind from running outweighs everything else. I'm sorry, go ahead.
You mentioned something that I thought was interesting. You said there's running as sport and there's running as a part of the sport
Yes.
that you're in. Every one of those that running is a part of the sport does not take place on concrete.
Well, this is true. This is very true. I mean, I don't know of anybody playing tackle football on the concrete.
No.
I don't know of any sport other than running in and of itself that happens through city streets. But I do want to. I don't want to. I don't want to blow off the point or the question to any minute little detail. And I want to say that football players get runners injuries. Basketball players run stop start sprints on a hard floor. Soccer players play on a very hard pitch. So that might not be concrete, but they're not exempt from the point that my friend on my right, the rest of the world's left, has mentioned. Okay. So another thing that I want to say about running, and I'm jumping ahead of something I intend to speak about in a little bit more detail, is there's good technique involved. That if you're like I drive to work on Saturday mornings, and I live in a very population dense urban neighborhood, and I see these groups of people who are out running together, and I see some of them look like that person is a well-oiled machine. That person can really, really run. and I see somebody else in the group that looks like they're just slamming their feet into the ground over and over, I want to stop and give them my card, but I got to get to work. All right. So your question about running is an excellent, excellent point. Thank you for bringing that up. And we talk about good technique. Every physical activity requires good technique. Whether we're talking about performing chiropractic adjustments, running, throwing a baseball, and that comes down to your posture, which is something that we're going to get into very shortly. Um, so the second question that I want to ask and answer is why would anyone want to be a chiropractic patient? First of all, you got to show up. I mean, there's no like we extol the virtues of the nutritional supplements all day long. Myself and Dr. Ross will be here speaking about the clinic. All the other presentations are about nutrition, and for good reason. We ship nutritional supplements literally all over the country. We get calls every day from people who they saw an infomercial, they saw a reel on Facebook, they saw something where the presenter is talking about some magic bullet and they want to know, do we carry that or anything similar? We cannot possibly in any way, shape, or form discount the critical importance of good nutrition, highlighting the nutritional supplementation. With that in mind, we'll mail the supplements to you. You can show up and buy a month's worth of supplements, a year's worth of supplements, and we won't see you until that stock is depleted. But if you want to be a chiropractic patient, you have to show up. Now, I don't know if this is real or if it's just one of those like urban legends in the profession, but we used to, in chiropractic school, we used to get warnings and we would hear about these chiropractors who ended up in jail because they told the patient, well, I'm adjusting your x-ray. I mean, how ludicrous is that? First of all. Second of all, how convenient is that? I mean, wouldn't it be easy if you could call me up and say, hey, Dr. O, could you kind of make a tweak to my x-ray? So you got to show up. And then once you show up for your appointment, we're gonna press on you and twist you and torque you. It's a little more sophisticated than that, but we're contorting your body into positions that we are looking for the places that are tightest. Question from Joe again.
You have to show up. Don't you have to preclude that by saying, or preface that by saying, they have to know it's an option.
Right. It's an option.
Perfect example is
yeah, it's an option. That there are a lot of options out there, and the world I know is natural health care. There's only a chiropractor on every block in every major city, so to come here is an option. Now, we are very, very conveniently located to the highway system in Pittsburgh, but we have people, I have a patient population who comes to see me from Northeastern Ohio. I have people from West Virginia. I had somebody come from as far away as Buffalo. I mean, that's a badge of honor. That's a feather in my cap. I appreciate those people very much that they made the effort to get here. Now, I don't appreciate them any more or less than the people who walk down the hill in terms of the treatment, in terms of how we interface with people, and we don't prioritize one person over another. But certainly, man, I'm humbled when somebody comes. They drove 50 miles through a combination of country roads, highways, and city streets to get here. We take care of them physically, and they turn around and drive 50 miles the other way. The exact same thing. So you got to make an effort. It's not easy. Why do people do that? And then they show up and, man, I'm looking for somewhere on their body that's tight, and I'm putting one of my pokey thumbs into it. And if that's not enough, you get an elbow. I mean, that hurts. That absolutely hurts. Why would you put yourself through that? Well, first of all, I want to explain how well Dr. Ross and I are trained. I went to Cleveland College in Kansas City. Dr. Ross went to Logan College. I think it's called Logan University now in St. Louis. St. Louis and Kansas City. Now we're 20 years apart, so it's not like we were buddies in school. But those two cities are about 250-ish miles apart. Ain't no speed limit on the Autobahn. If you can't drive from Kansas City Midtown to St. Louis Midtown in 4 hours or less, you're sitting in the back seat next time. Right? So we would do workshops at our school, and there would be workshops at Logan in St. Louis, and there would be workshops in Davenport, Iowa. There was a speed limit on US 35, and different story. So we would go from those three schools over the course of weekends to learn from people who were not necessarily affiliated with the school, but they taught their technique. So my primary people who I trained with are called the Motion Palpation Institute. Um, my mentors, or my primary mentors through them, is a guy named Mark King, and his associates were Terry Elder and Keith Innes. Now, between those three guys, God only knows how many professional athletes, how many professional teams, how many Olympic athletes they've treated. And I like to highlight high end athletes as patients. And the reason for that, they don't get special care, they don't get special privilege. They got to call and make appointments just like everybody else. But when people are making millions of dollars using their body as a tool to bring home that kind of income, and they pick you, they say, I want to treat with you, that matters. That's another feather in everybody's cap. Now, at this point, I've treated professional athletes or world champion amateurs in 14 different sports. Like I said, I got a 20-year head start on Dr. Ross, and I've seen some of the people who've come through here to treat with him. Big time feather in his cap. These people are paying for their education by using their bodies. They're collecting $1 million paychecks by using their bodies. They are very, very highly selective. They are not looking up. Do we still have yellow pages? They're not Googling chiropractic and saying, oh, this person is right down the hill. That's where I want to go. They're going where their coaches tell them. They're going where their peers have had good results. And that's sort of a measuring stick for chiropractors, and for chiropractic in general, is who are the high end athletes that you're treating. And I'm not a big name dropper, so I'm not going to tell you about the former Olympic decathlon gold medalists that I treated, nor am I going to tell you about the man who was then at that point the fastest man in the world. And a chance to talk with them, to talk with their coaches, and they're like, "Hey, this is our guy. We want you to make these adjustments." Um, when I was training with the MPI group, there was one guy who went to Logan College who was a contemporary of mine. His name is Brett Winchester. Brett, if you're listening to this on Cyberland, I know I owe you dinner. I'm not trying to weasel out of anything. I'll see you when I see you. Uh, um, Brett's now the team chiropractor for the St. Louis Cardinals, and he's a professor at Logan University. Guess who Dr. Ross's professor was for sports injuries and sports biomechanics when he was in school? So anyhow, I say this partially to tell you how great the people are. Brett and I would work together at workshops, and we'd be practice partners with each other. And when he came to Kansas City, he'd occasionally stay at my house. I stayed at his place in St. Louis. We're poor students on a budget. You got to sleep on the couch somewhere. It might as well be there. But anyhow, I say this to highlight that the correlations between Dr. Ross and myself, and to say that if you're coming in and you see one of us and not the other, or the other and not the one, we're all following the same yellow brick road. I was trained in neurology with under Dr. Ted Carrick and under Dr. Ken Erickson. You guys may remember in 2009 when Sidney Crosby was having all of his concussion issues, and they brought in this chiropractic consultant, and the UPMC neurology people went batshit. And weeks later, Crosby was back on the ice. That was Ted Carrick. He was the consultant that the Penguins, or that the Crosby family, brought in. And Ken Erickson is the official team chiropractor for what's known as the Highest Stand Jiu Jitsu Academy. If you follow the sport, those are the Armenians. God only knows how many world champions they've managed to bring home. When I was doing my neurology training, I remember somebody in specific who was in the audience with me, studying, grinding, trying to figure it all out. Dr. William Huber. Once again, you know your old Wen. Guess who Dr. Ross's professor of neurology was at Logan? If you say William Huber, you're right. Um, Another one of my very good mentors was a guy named Mark Charette. Mark taught me a lot of the extremity work that I do. Mark went to go teach a workshop in Australia, and he did so well, and he was so well received that the Australian Chiropractic Society gave him a license to practice on the spot. Now, it never occurred to me, like, why would anybody want to move to Australia? That's a long way from home. So, I Googled it. How do you immigrate to Australia? Well, there's a lot of paperwork, a lot of red tape, a lot of time and effort, and the Australian Chiropractic Society just waived all of it for him. I hope he goes. I hope he stays. But anyway, what an incredible honor that is. So between me and Dr. Ross, we've trained under some incredible people, and I'm just talking about the chiropractic training. I haven't even mentioned the physical exam. Every once in a rare while, somebody with a red flag, life or death, medical emergency walks into the building. It does not happen often, but you better be paying attention when it does. And Dr. Ross and I caught one of those that you're not gonna sneak by me. That maybe now is really not the time, and your injury is not the sort, and this isn't the place for you. But we will help you get to where it is that you need to go for something that might be more important. Dr. Ross and I are both we're both update we do updated education on really on everything. Dr. Ross is a passed his test to be a certified chiropractic sports physician. He has a certification from a professional golf organization. I did my primary spinal practitioner certification through the University of Pittsburgh. So we're not resting on our laurels. We're not taking the attitude, well, I graduated school and now I know everything I need to know. So I'm good. No, we're constantly upgrading. We're looking for opportunities to learn more. We're looking for opportunities to teach. We're looking for patients to practice. Well, I want to practice on, but if you come to see us, you see us in our practice. So we're practicing on patients. So we're always looking for new patients and new people that we're able to help. So, reason number one, why would you want to be a chiropractic patient? Because we're very well trained, we're very conscientious, we know what we're doing, and we're going to be able to. If you have a chiropractic related natural health problem, we are going to be able to help you. And if you have a more serious problem that needs emergency attention, we're going to be able to help you find it. Now, as part of my battery of tricks and all the things that I do, I'm a big fan of low tech rehab. Uh, um, Rehab, of course, entails doing some exercises. Low tech means that we don't need equipment. We don't need to send you to the gym. We don't need to do fancy stuff. We're concerned about your posture, your balance, the way you breathe, the way you move your body through space. And those are all things that could be done on a very, very tight budget. So let's do a low tech exercise. So if you're in Cyberland, feel free to join along with us. If you're here in the crowd, feel free to join along with us. And I don't care if you're sitting or if you're standing. But what I want you to do is think about on your anatomy where your belt buckle would live, and think about the spot at the bottom of your chest where your rib cage kind of comes to an arch, and we're at the apex of that arch, so it's the bottom of your sternum. And I want you to separate those two parts as much as possible. So what you're going to do is you're going to be long, or you're going to be really tall in the bottom half of your torso. And I appreciate the people, especially behind the desk, that I can see sitting up. Now, we're going to be very tall and long in our torso. And what you should feel is that your shoulders are rocking backwards. So you should feel like you have a hinge at your belt buckle, and you're almost doing a back bend from there. You almost back bending or hinging backwards from the top of the bottom of your rib cage, the top of your abdomen, and that your shoulders are falling backwards. And so if you feel like I'm almost rocking myself backwards, you're doing it right. So I just want to take a couple 3 seconds or even 4 seconds, and everybody just hold that posture and think about, like, man, if I did this, if I really, really focused on this for 3 or 4 seconds at a time, 5, 10, 50 different times a day, this would become my normal posture, and at least in this region of my body. And man, I'd be a little bit taller. I'd breathe a little bit easier. I'd be able to activate the musculature from my core to initiate movement just a little bit better. It's a good thing. All right. Anybody cool with that? Questions, comments, moral outrages? And I roll on. Why else would somebody want to be a chiropractic patient? Remember, you called up, you made an appointment, you scheduled with Ashton, Madeline, or Courtney, our stellar first front desk staff. You made the effort to drive up Green Tree Hill or down Green Tree Hill, as the case may be. You went through the forest, through the woods, and realized that Green Tree is actually convenient to your location, and you showed up here. And then you were on mine or Dr. Ross's table, and we're putting that mighty thumb into a pressure point between your shoulder blades or maybe at the base of your scalp. And we're twisting your body to the point where it's going to twist so far that it might even make a noise as it releases. And you chose this. Nobody took you hostage. Nobody kidnapped you. You actually wanted to be here. We got to make it worth your while. We got to make good magic happen for you if you're going to put yourself through all that travel, showing up, waiting, and enduring my thumb and or elbow in your trigger points. So lately, I don't know exactly how this began. I'm guessing it was from a pretty good Facebook post that went viral or YouTube video or something in social media. I've had a lot of people ask me how they can stimulate their vagus nerve. Well, first of all, what is the vagus nerve? You have 12 cranial nerves. Those are nerves that come off of your brain, not your spinal cord, and they help to control highly specific body events. Your vagus nerve, like the other 11 cranial nerves, you actually have two of them, one on either side. So the vagus nerve travels down from the brain stem, the bottom part of the brain, into the torso, where it provides parasympathetic stimulation to the heart, to the lungs, to the digestive tract. What does that mean? Think about your sympathetic nervous system as your fight or flight. As I told you a few minutes ago, I appreciate the fact that none of you are throwing rotten vegetables at me, but I am not afraid of you. As I stand up here and speak with you, you probably notice that I'm tall in my torso. I'm exercising good posture as I stand here. I'm not feeling very defensive. I'm not feeling threatened. I'm relaxing into my lecture or workshop, sorry. I'm breathing in my normal rhythmic cadence sense. My parasympathetics, my rest and digest, my wine and dine, my just be cool aspect of my nervous system is engaged. In contrast, the sympathetic nervous system will wind you up. I'd be sitting here covering and ducking from flying produce. I'd be looking for somebody to pick that produce up and throw it back at them. That is sympathetic nervous system activity. Nothing is all good. Nothing is all bad. We absolutely need to have a sympathetic nervous system, highly compatible with survival. You will not survive if you don't heed the warnings of your environment, which will trigger your sympathetic nervous system. That being said, patient says, Dr. O, how can I stimulate my vagus nerve? Oh, wow, I did not see that one coming. That's some pretty sophisticated level of knowledge of anatomy if you know what the vagus nerve is and you want to stimulate it. Well, chiropractic, there's no magic bullet. There's no one single maneuver that says, "Oh, well, I'm going to just keep tapping on my sternum until my vagus nerve relaxes." No, you'll probably bruise your sternum first. But anyhow, chiropractic adjustments and chiropractic treatments excite the brain stem, stimulate the vagus nerve, promote more vagal activity, and inhibit the sympathetic nervous system. So, I don't know how many people sitting here. I mean, I recognize faces, but I don't recognize everybody. I don't know how many people are chiropractic patients here or they're patients somewhere else. Not a day goes by. every single day. I adjust somebody and they say, wow, I could really go for a nap now. I take that as a compliment. You need a nap because something that we did together in here caused you to relax and caused your vagus nerve to turn on just a little bit more. And now you're feeling like, oh man, that's good. I could shut my eyes. So, why would you want to be a chiropractic patient? Well, we talked about the training that Dr. Ross and I have. We talk about how we're going to stimulate your vagus nerve and achieve a better parasympathetic sympathetic balance. Let's talk about posture for a second. Your posture is the position that your body is in as a starting point for activity. So if I'm going to sit at my desk and type, I have not yet begun the process of typing, right? So the position that my body is in is the position that I'm starting in. So would I be more at an advantage as a typist if I were sitting up long in my abdomen, torso, good posture, shoulders back? I'm going to extend my arms. And because my shoulders are in that back position, I can only extend my arms, but so far. And I'm maintaining the integrity of the angles of my wrist, my elbows, and my shoulder. I'm sitting up straight. I'm typing efficiently. Or if I'm slumped over, struggling to breathe, leaning into the keyboard, I would go with that relaxed posture to start with, and put yourself in an advantage for kinetic or mechanical movement. Now, to my friend who asked the question about running, think about the pounding of your joints for a second. One's feet are designed to be shock absorbers. When you run and you strike the ground and you explode back up into the next step, your foot should compress and expand. It should compress and expand as it interfaces with the ground and propels you forward. And as part of that compression and expansion of the foot, we're dissipating shock. Your knees are designed to be hinges. So if this represents your bone of your thigh and this is the bone of your shin, your femur and your tibia, and your knees are doing this as you run along or they're shearing, you're going to suffer significantly more biomechanical pounding and deterioration than if you were at a better starting point and running with the appropriate body posture, also known as running as good technique. Does that help clarify just a little bit more what we were getting at earlier? Okay. My friend doesn't think she's going to run, and you know, save your knees, save your hips, save your feet. I'm sorry, you're missing out on a good time. I don't know what to say. Okay, walking will work. All right. So why else would you want to be a chiropractic patient? Um, you have mechanisms of your body that cause alarm. If something is wrong, your body is going to tell your brain so, in the form of, well, one of the forms is pain. If I bump my elbow hard enough, I'm gonna perceive local injury. I'm gonna perceive that it really hurts right here. But what's happening is my elbow is sending messages through my nervous system to my brain to say something's haywire. Like we just got bumped. I don't want to be bumped again. Don't let this happen. Protect me. And the brain is going to register pain in the elbow, and now my elbow hurts, so I'm going to be more diligent and I'm not going to bump it again. And the musculature in the top of my forearms and the bottom of my upper arm and maybe even as far up as my shoulder are all going to tighten up to prevent me from moving my arm and specifically my elbow joint. And man, that's really starts to hurt. So now that I've suffered sufficient hurt and sufficient punishment for banging my elbow against the wall, I got to get out of pain. I mean, I do not like this sensation. So I want to start intercepting messages. I want the elbow to quit sending messages to the brain saying we hurt, do something. Those messages that we're going to intercept there are called presynaptic inhibition. A synapse is where two nerves come together to communicate with one another. And so if we're presynaptic, that means we're going to do something to shut down the message before it gets from one synapse to the next. Chiropractic adjustments are very, very good to stimulate the mechanisms that stimulate that presynaptic inhibition and shut off those messages. Chiropractic treatments and adjustments also activate what is called uh, um, descending inhibitory pathways. So descending means it's coming down. Where is it coming down from? It's coming down from the brain. Okay, so the brain is going to inhibit more pain. It's going to inhibit more the lack of motion, the muscle spasms, the irritation. We want the brain to inhibit that cycle of events. So chiropractic adjustments are going to help. Uh, um, they're going to help suppress pain at two distinct levels. Once again, we want to make sure that we get good nutrition to help alleviate and get rid of and evaporate the inflammation that builds up with injury. But we also have to do things that stimulate the nervous system to change the messaging that goes along. So far, so good? Excellent. So, why else would you want to come see myself or Dr. Ross and be a chiropractic patient? Well, both of us have pretty good nutritional backgrounds. Now, I don't. We have had some incredible nutritionist practice here over the years. We've had. I mean, I think there are people who are listening in and are sitting here who even go far back enough to remember Dr. Weiner, who was really uh, um, man, he was a good nutritionist. Let's leave it at that. In fact, my nutritional training also came from the Motion Palpation Institute. I studied under a doctor named David Seaman, and I remember when I talked to Dr. Weiner the first time we met, he told me that he has a stack of resumes, and a lot of people want to come and work there, and it's this is a much coveted job. And I said, well, who wouldn't want to come and work there? That's good. I mean, I just left one job and I have a number of offers at another place. And there was this implied, I don't need you and you don't need me. Right. So we had this job interview, this conversation that was, it's on like not a place of neediness, that we're just able to sit and talk like two professional colleagues who are making a decision that whether or not they want to work together. And so Dr. Weiner, when I told him, he said, well, what do you know about nutrition? I said, well, I know what David Seaman taught me. David Seaman, you studied with him? No, well, okay. So anyhow, that was one of the things that he knew my people and I knew his people. So neither Dr. Ross and I are nutritionists of the caliber of Dr. Weiner or David Seaman, for that matter, or some of the people who've worked here. But both of us are very capable of answering some basic questions, helping our patient population, and even the people who walk into the shop and aren't necessarily patients, help them find what they're looking for, help them get started with a protocol. And we have some wonderful people who don't necessarily work here that we refer to. Which brings me to my next point. Why else would somebody want to come here and be our patient? Well, we have a great network. Now, unfortunately, with COVID, a number of people who were in natural health and a number of people who were in healing arts and people who were in medicine, the deck was reshuffled. That a lot of people retired or quit or just didn't want to do it anymore, or you know what, I'm going to do something from Zoom at home and I don't want to see patients, and it's okay. So our network, we used to, you say, hey, do you guys know a pediatrician that will have a lax attitude or would accept my child into his or her practice because of my philosophy of childhood immunizations? And the answer used to be yes, of course we have somebody. And the question used to be, hey, do you know a good GI/GU doctor who's open to nutritional supplementation in conjunction with whatever they are? Yes, of course we do. But our list has become depleted. We are rebuilding our network, but we have one for some things. So if you are out there in cyberland and you're listening to the things that I have to say, and you feel like Pittsburgh is just too far to go for a chiropractic session, and you're wondering, do I have somebody in your area? Try me. I might. Send us an email. Reach out on Facebook. If you are local and you're looking for a doctor, a medical doctor who does prolotherapy or IV vitamin C or IV peroxide, we got people. We got people. I mean, not a day goes by where somebody doesn't ask, "Hey, do you know somebody who does whatever? Fill in the blank." And in a pre-COVID world, the answer was yes, absolutely. Let me go get you their number. In a post-COVID world, the answer is, I hope so. Let me check. But we have a great network of the people we do have, and that might be a good enough reason to get involved with us, to get access to our people. What else can I tell you? Why else would somebody want to be a chiropractic patient here? Well, when you learn technique and when you learn how to work on a person, on a body, the first person you learn on is yourself. There is no maneuver in my bag of tricks. My bag of tricks is deep, but it's finite. There's no patient that I have currently that I think has seen the bottom of my bag, but it's not bottomless. Every single maneuver I do started with somebody doing on me, then teaching me how to do it in an explanation, through demonstration on somebody else, through supervision of me doing it on somebody else, to the point where the instructor, the mentor said, you know what? I can trust you out in the wild to do this without looking over your shoulder. Good luck. Now, this means that both Dr. Ross and I are both sympathetic and empathetic. We have can you imagine how painful it is to be treated for a dislocated shoulder that you don't have? I mean, that's an unpleasant experience. Let me tell you. But would it really be fair for me to treat somebody's shoulder dislocation if I didn't know how all those maneuvers felt and experienced how they work together? All right, so we're sympathetic, we're empathetic, we're skilled, we're highly trained, we know people. We're going to help you find a good balance between your sympathetic and your parasympathetic nervous system. We're going to help you with the nutrition. I'm sold. You should come in, but let me up the ante. We talked about that posture, that being tall in this section of your body and throwing your shoulder blades backwards and down. So those diamond shaped bones that cover the tops parts of your rib cage, now they're going to be pointed down towards your belt, as far down, reaching for your belt as possible with your shoulder blades, which re-emphasizes this shoulders back. It overemphasizes this hinge-like theory where you're hinging backwards in two places and you feel like you might even fall over backwards. So we're in this position. And once again, you can do this sitting, you can do this standing. And while you're holding this position, I want you to take a deep breath in through your nose. So our whole torsos are expanding as that delicious oxygen comes in. But because our shoulder blades are trying to touch our belts, we're not shrugging up. We're simply rocking further and further back, opening our chest cavities, and we're going to hold that delicious oxygen for a moment in time, 2, 3, 4, and blow out through your mouths. Let's do that again. Big deep breath in through your nose. Shoulder blades just keep rocking further and further back. Abdomen keeps getting taller and taller, longer and longer. And we're holding and we're holding and we're holding some more and we're holding again. And we're going to hold still and blow out through your mouths. Let's do another one. Deep breath in through your nose. Everything is opening, expanding, holding and growing bigger. And blow out through your mouths. Okay. Any feedback from the crowd, live or in Cyberland? Nope. In the past, In the past, people have taken those 2 or 3 deep breaths with me and they've thought, wow, I feel lightheaded. I feel like my chest cavity doesn't expand. Well, those are signs or a couple of things that lightheadedness might be a sign that your body is just not an efficient, deep breathing organism. Got to work on that. Now, I've said this several times during this workshop as to how important the nutritional supplementation is. I mean, we beat that up. You'll hear a number of our nutritional sales force teams talk about it. You'll hear Joe Messina, who contributed to our workshop here. You'll hear Jamie Dorley, runs the whole show, talk about nutrition because it is so critically important. Nothing I'm talking about works, whether we're talking about chiropractic treatment or nutritional therapies, if you can't get enough oxygen into your system to fuel your pumps. You must be a good breather. You must. So if you're getting lightheaded, taking these 2 or 3 deep breaths with me, that's a sign that you need to work on your deep breathing mechanisms. And I wouldn't be at all surprised if Christine, our spiritual healer, our spiritual gangster, wouldn't have a few kind words to say about the necessity of deep breathing in conjunction with the spiritual energetic work that she does. You will have a very, very hard time finding a practitioner, regardless of the initials after their name, who will disagree with me, who say that breathing is so critically important to your systemic well-being, and it supersedes all. Now, if you are getting lightheaded with these 2 or 3 deep breaths, your warning light should be flashing, and you should think very strongly about following this suggestion. Find a comfortable chair, sit up straight, take 2 to 5 deep breaths in slow, rhythmic fashion, focusing on how long you can become in here, focusing on how far back you can throw your shoulders, thinking about how big you can expand your chest cavity to be as you inhale, and just simply get better at it through exercise. It's easy. If that deep breath hurts you because you feel a pinching between your shoulder blades, or maybe even a tightness in your chest, you might have rib dysfunction coupled with intercostal muscle spasms or coupled with scapular muscle spasms. The scapula is your shoulder blade. The intercostal muscles are a little film of muscle that live in between one level of rib and the next. These are things that I see patients for multiple times every single day. So that is what's known as a shameless plug, where you get a chance to diagnose yourself because of breathing difficulties. And you say, you know what? Today's the day I'm calling those people at the World of Wellness. I'm scheduling an appointment with Dr. O or Dr. Ross, and I'm going to get this taken care of. Why else would you want to be a chiropractic patient here? Well, we're grounded. We're grounded. We're calm. We are parasympathetic people here. Oftentimes, patients will come in with blood chemistry reports. They'll come in with X-ray or MRI reports, and nobody explained it to them. Now, I looked at somebody's blood chemistry report very recently, and it took me a little over an hour to look up all the values. And just because something is high doesn't mean it's a problem. Just because it's low, it doesn't necessarily mean it's a problem in and of themselves. We want to make correlations and groupings, and look at the blood chemistry report as a total system, not as a uh-oh, this is high, let's lower it. It takes time. So please don't just show up with your blood chemistry report. But if you're a patient and you want to make a copy of it and leave it with me, that's a different story. We look at your MRI report, and I'm kind of like, the orthopedist should have explained this. Your primary, whoever ordered it, should have explained this. But we look at your data, the data generated from your body, and we'll explain it to you and contextualize everything. And as I said much earlier in the conversation, if there's a red flag emergency, we're going to find it. If we're looking at a report that contains a lot of observations without actually saying that there's a problem, we're going to explain that to you. So we take a grounded, just let's just calm down and look at this and figure it out without hitting the panic button approach. Another reason why I think you do well to be a patient here is we're going to solve your problems on a budget. We're not out to beat you. We do not participate with insurance. We expect our patients to pay for care, but we look at what are we actually doing here? How much time are we spending with patients? How many different body parts are we addressing? And our office fees are comparable to people who do 5 minutes of spinal adjusting and send their patients on their way. So we're really looking to constantly upgrade our skills, our knowledge, our understanding. We're looking to find new and innovative ways to help our patients. We're trying to make our patients feel as comfortable as possible and leave them with as deep an understanding of what they have going on or not going on. And we're looking for economical ways to help those patients solve those problems. So I think it's a big win all around. We are currently taking new patients at our Green Tree office. So if you're listening in on Cyberland and you want to interact, please do so by Facebook. If you're here in the crowd and you're just wandering through and you're thinking you've been on the fence about, do I really want to be a chiropractic patient? Consider this your invitation, open and understood. Questions, comments, moral outrages, stuff from the crowd. All right. In that case, I want to thank everybody for the kind attention and for bearing with me and for participating and for not throwing rancid produce and all that kind of good stuff. And thank you all so much. Be safe and healthy.